Hello, everyone. This is Dr. Kishore here, and we'll be discussing about a very important skin disorder in this lesion that is called lichen planus. Now, the first thing that you need to understand that the name itself tells you few interesting aspects of this disease. So you can divide or break this term lichen planus into two: lichen plus planus. And the term lichen means moss-like. You have seen fern moss over the trees, or if you have visited rainforest or forest areas, you have seen that over the trees some brownish lesions grow, moss-like. That is the term actually lichen. And the same thing of kind of lesions when grow over the skin of the human body, we term them, and they have a flat top. Planus means plain, flat top lesion. We call it lichen planus. It's a mucocutaneous lesion. It's a mucocutaneous disorder. Cutaneous disorder involving, that means it involves both the skin and the mucous membrane, affecting middle-aged adults. Middle-aged means 30 to 60 years, typically we see this. Why it occurs, it's not fully known, but we think that this is suspected to be of autoimmune etiology. Thought to be of autoimmune etiology. And there's a role of CD8 plus T cells, the thing which act against the basal keratinocytes, or I not say basal actually, the keratinocytes of the skin. In the epidermis layer. So if you have mastered these things, then we need to go through some more important aspect of this disease. So let us go to the next thing actually, that how this disease is usually present. So let me clear this thing. So lichen planus, as I mentioned, it involves skin and mucous membrane, particularly the oral mucous membrane. And usually the lesions of the skin, they have certain characteristic features. They're usually called 6 Ps. 6 Ps of lichen planus. And what are those 6 Ps? Even lichen planus also itself has a P, if we have noted. 1 P is for purple, because you usually have purple colored lesion. Another P is for planus or planar, which means flat topped. Another P is for polygonal, because the lesions usually have multiple angle, polygonal, irregular borders, and they usually also are pruritic, and they usually can appear as plaque or papules. Plaques or papules. So as you noted, there are 6 P's here. There is purple colored lesion. It is planar, flat top lesion. It is polygonal in appearance. It is pruritic. It appears as plaques or papules. So these are the 6 P's of the lichen planus lesions we usually see. Another important aspect that you need to keep in mind about lichen planus, which will be often tested also, there is a very important characteristic feature. It's called Weekham's striae. Weekham's striae. What is Weekham's striae? They're basically white, net-like, white net-like lesions seen over the surface of mucosal lesions. And as I mentioned that this Wickham striae, if you see particularly the oral cavity that characteristically seen, is quite diagnostic for lichen planus. So please keep in mind this term, Wickham striae. And other than oral cavity, I would like to mention that it can also be seen in other places. In the mucous lesions can be seen. Oral cavity, not only the oral cavity, it can also be seen in esophagus. And it can also be seen in the genitalia. These are some other aspects that you should keep in mind. Next thing that you need to keep in mind is the subtypes of the lichen planus. Subtypes of LP. LP means lichen planus. And the subtypes, what you need to know, that is hypertrophic lichen planus or lichen planopilaris, which I would first like to mention, that is important. Lichen planopilaris. Typically seen in affect the scalps of the lesion patients. Scalp of the patient. And often present with hair loss and pruritus. Hair loss. Another characteristic subtype is called hypertrophic lichen planus. Hypertrophic lichen planus, which typically affects the seen area. And as you see from the name that it's basically, also some people call it verrucous lichen planus verrucous, also known as lichen planus verrucous. So this is another interesting aspect that you keep in mind of this. Next, we'll go to the diagnosis aspect, diagnosis part. Diagnosis is mostly clinical, but in pathology part, if you do in this clinical biopsy, in the skin biopsy, you'll be getting some characteristic points and typical histologic features which will be seen. And those characteristic features are hyperkeratosis without parakeratosis. This is a very important aspect of this thing. Hyperkeratosis without parakeratosis. Without parakeratosis. Hyperkeratosis basically means thickening of the stratum corneum, and parakeratosis means presence of nucleated cells in the stratum corneum. Now, a lot of conditions you can get hyperkeratosis with parakeratosis, for example, in psoriasis. But this is a condition where you get hyperkeratosis without parakeratosis. That's the important aspect. Then you can also see hypergranulosis. Hypergranulosis means thickening of the granular layer. Thickening of granular layer to be seen of the epidermis. And a very characteristic feature we see is that it is called interface dermatitis. At the interface dermatitis means that at the junction of the dermis and epidermis, suppose this is a skin biopsy, I'm drawing in, suppose this is a skin biopsy, this is basement membrane. At the top there is epidermis and below there is dermis. this basement membrane basically divides into epidermis and dermis. Epidermis is basically made of layers of keratinocytes like this. So what you'll be seeing that at the junction of the dermis and epidermis, here, there will be a lot of lymphocytic infiltration. So interface means at the junction between, at the junction between dermis and epidermis, we see lymphocytic infiltration. This is a very characteristic feature of lichen planus, and we call it interface dermatitis. Keep this in. Other than that, we also see sawtooth appearance of the dermo-epidermal junction, the characteristically say, and we can also see irregular acanthosis. So these are the characteristic feature. Another term they will be asking you sometimes, that is called Max Joseph space. Max Joseph space is some spaces which will be seen at the junction between dermis and epidermis. That is called Max Joseph space that you need to keep in mind about this. And colloid, some basal apoptotic keratinocytes are also seen. The epidermis, that is called seabed bodies. So these are the most characteristic features which you'll be seeing on the skin biopsy in this condition. That is the point worth remembering. And so lastly, if we summary, it's basically an autoimmune etiology. It's thought to be an presumed autoimmune etiology. This is thought to be there's a role of CD8 cell, 8 T cells. Second aspect is that typically involves 60 to 60 years population, middle-aged adults, can involve skin, mucous membrane, a lot of organs, like I mentioned, genitalia, oral cavity particularly, and the esophagus. There will be characteristic subtypes. And on the biopsy, you'll be getting a lot of characteristic features. Dermo-epidermal junction, there will be band of lymphocytes. Then you can see there is a presence of hypergranulosis, the granular layer thickening, sawtooth appearance of the dermo-epidermal junction. And also you can see the presence of Max Joseph space or colloid or civil bodies. Lastly, I forgot to mention one thing, that there could be some characteristic nail changes also that you need to keep in mind. Like it could be nail thinning. There could be pterygium of nail. And puppy tent appearance of them. Now I'll be doing a separate video to basically explain these nail changes in skin disorders. But just remember that psoriasis also has some characteristic nail changes which you can basically see in these disorders. So that's all actually for this session that you need to keep in mind. And for this disease, for this lichen planus. So typically remember that this is an example of interface dermatitis. And also this can present with a nail change, involves oral cavity, mucous membrane, oral cavity that will be Wickham stria. Skin clinical appearance is quite diagnostic, but if you do the biopsy, you'll be getting those characteristic features. So that's all for this learning session on the lichen planus.